guys, welcome to my channel. Thank you guys so much for coming back. If you guys remember who this is,
I'm Naya.
This is Naya. This is my best friend. I think the last time you saw her, we were both pregnant, and we're not anymore.
No.
Because we had our babies, obviously. I think my baby's 1.5 months older than her baby. So we just wanted to do a video for you guys. So today we're going to answer a very much requested question, which is, what is clinical? A lot of people want to know what clinical is, what exactly clinical is. So today we're going to be talking to you guys about what clinical is, what to expect, and how to act at clinicals to facilitate your success when you go to nursing school or if you're already in nursing school. So that is what this video is going to be about. So if you want to hear all about it, then please stay tuned. Okay guys, welcome back to my channel. Thank you so much for coming back. As I said before, a lot of you guys know Naya, but for those of you who don't, her name is Naya. She is my best friend. We met in college, in nursing school, and we've been friends ever since. I think this is our, fourth year?
Fourth year, yeah.
We've watched each other grow. She's had 2 babies. I have 1 baby. We came from just having these dates where we would go out and eat together and just talk about random stuff, and then now we come on dates, but all we talk about is babies, babies, babies. So today we just wanted to come to you guys with some very informative information, especially about clinical, because this is a question I get a lot. And Naya is a pediatric nurse. She used to work in the pediatric unit. She doesn't work there anymore, but that's her specialty. And for me, you guys know that I recently started doing home health. So we are both bachelor degree nurses, and we both went through nursing school, and we had a lot of clinicals. And since I've been getting this question a lot, and Naya and I, because we met in nursing school, we had a lot of our clinical experiences together. So I thought she would be the perfect person that we can talk about this topic with. So Naya is going to tell you guys first what clinical really is, and then we'll jump right into the topic.
So a clinical is a core component of nursing education. So basically whatever you learn in the classroom, like books, you put out in the real world, whether that be like a hospital, a nursing home, military base,
rehab facilities,
wherever it is.
With that being said, now that you know what clinical is, we're going to tell you how to prepare for clinical, what to expect, and how to act once you're at clinical. So first thing first, we're going to talk about how to prepare for clinical. So this is one question I get a lot. People write to me all the time and say, I started nursing school, I haven't had my first clinical yet, but I'm going to start clinicals next month or next week. So how should I prepare for that? So what would you say? How would you prepare for clinical?
So for example, if you're going to a med-surg clinical, brush up on the basic disease process like diabetes, CHF, lung diseases, anything that you would see in a common patient, brush up on. Like for diabetes, know the signs and symptoms, how to care for a patient. Like for CHF patient, you would do daily weights, first thing in the morning at the same time. And then what medications do they have? What time do you give it?
That's a good point, because as Naya said, whatever clinical you're doing, you want to freshen up on your disease processes. So to make this easy, sometimes your professor will tell you the day before the clinical what patient you're going to take care of, and they're going to give you their medications, their disease process, and sometimes they'll have you do like a case study. So the best way to prepare for that is, if you're lucky enough to get that information beforehand, I would say look up the patient's medication, see what the side effects are, what the contraindications are, and just things to watch out for. And you also have to familiarize yourself with the medication, because you don't want the first time you give a medication to a patient to be the first time you have ever heard about the medication. And you look really bad too in front of your professor when you go to give the medication, and sometimes they'll ask you, what is this medication?
Always ask you, what are the signs and symptoms you look for? For example, when you give a beta blocker, you have to check their blood pressure. If it's below a certain amount, you don't give it. So they're going to ask you stuff that you should already know beforehand.
Their blood pressure, their heart rate, and you have to check all of that. So that is a good way to prepare, because we can say, look up every disease process or look up this, but you might not have a patient that has that disease process, and that might be a little bit overwhelming for you. So I would just say, if your professor is one of those professors that tells you what the patient is you're going to have, then go ahead and look them up. But if they don't, sometimes you can ask them. Just ask, what patients are we taking care of tomorrow? Like, what can I do to prepare myself? So that's a great way to prepare. And another way to prepare physically for clinical, I would say, have a stethoscope.
Oh, yeah.
Yeah, have a stethoscope. Whatever your uniform dress code is, make sure you follow that, because some professors will send you home. Yeah. If you don't have, like, if you're supposed to wear white shoes and you show up with green shoes,
they're gonna send you home.
They're gonna send you home. I would send you home too, because
it doesn't look professional.
Exactly. And I know a lot of us have our own personalities and we have our own, just who we are. But when it comes to nursing school, sometimes you have to kind of put that away, especially if you want to succeed. So if you're the kind of girl that likes to wear blue hair, or you like to wear like flashy makeup, and I know I like a lot of makeup, but you have to tune it down a little bit. Let's say your clinical uniform is green and black. You can't show up with like purple hair and purple shoes and stuff like that, or heavy makeup, or like makeup that has different colors. You can still do your makeup, just tune it down a little bit.
Very light.
Right, very light, very professional. And
they say not to wear any perfume at clinical because it can be harsh for patients.
Yeah, because you're taking care of people who are sick, and a lot of them are sensitive to smell, so you want to tune down your perfume. And if you have those strong ones, maybe just wear deodorant or something like that.
Lightly scented lotion.
Right.
And then if you have tattoos, you have to cover them up. If you have piercings, you take them out. Like I have a nose piercing, so every time I went to clinical, I would take out my nose ring because it's not professional.
Right. And I would say to time wise, if your clinical starts at 7, if you're there at 7, you're late.
You're late.
You have to be at least 15 minutes early, which I kind of used to be late a lot. I used to show up at 7. Lucky for me, my professor was nice, but honestly, we used to have to drive an hour away. That was far. I was lucky to be there on time, okay? Like, we were all lucky because it was winter time. I remember one of our clinicals, it was winter, it was snowing. It's like a one-way. Yeah, like one-way to, one-way fro. And there's a lot of cars going to work. There's a lot of people on the roads, and you're supposed to get there early. And I just did, like, I was never late, but I was there on time. But like I said, if you're supposed to be there at 7 and you show up at 7, you're considered late. So,
like, for example, in the real nursing world, you have to show up early so you can look up your patients. True. You can prepare, look up their medication.
That's a good point. That's probably why they do that, to get you used to it.
Yeah, because you can't be there at 7, because if you get there at 7, when are you going to look up your patients, look up their medications, when are you going to get report?
Right.
So time is very essential in nursing. You have to, be early.
Right. And you always have to have your badge. If you don't have your badge, you will get sent home, because that's your identity. And the field of nursing is very protective, especially when it comes to HIPAA reasons and stuff like that. There are a lot of imposters, and people just walk off the street and go in there and try to make up stories to steal babies or to hear about some people's medical issues. So you have to have an identity. You have to have something that proves that you're either working for that facility or you are with a certain school. So if you show up without your badge, yes, your professor can vouch for you and say, hey, that's my student, but how do they prove it? So,
and also it's very unprofessional.
It's very, very unprofessional. Like, how do you go anywhere without your badge? And we mentioned this because this is something very, very easy to forget. Because you go home, you take off your uniform, you put it down, and by the time you know it's time to go to school, and you just grab stuff real quick and you don't have your badge. And if you drove 1 hour away like we used to do, you get sent home. There's no saying, oh, I'm gonna drive home like 15 minutes and grab my badge. Yeah, so do some medication cards. Like I said, look up your patient, look up the medication, have little flashcards with the medication. What does it treat? What are the contraindications? What are the side effects? Just the simple things. Your professor is not gonna expect you to know everything, but just the fact that you have that little piece of paper and you show effort, that's going to show them that you actually care.
And you're ready to learn, too.
Right. Because let's face it, no nurse knows every medication. Even up till now, sometimes when you go to work, sometimes I have to call pharmacy. When they send up a certain medication that I don't know, I'll call pharmacy and say, hey, what is this medication? Like, I've never heard about this before. Like, how do you use it? Or what do you do with it? So, but it's just looking professional and looking like you actually care. Stuff like that is what your professors want to see. So yeah, that's how you prepare for clinical. So what to expect at clinicals? What would you say?
just be expected to do anything and everything.
Right.
Do vitals. Give their medications. If they have breakfast, get their trays, you know. If they need help getting into the bathroom, do that.
Yeah.
Always ask a nurse.
Right.
What can I do? Can I follow you around? Is there any procedures that I can watch?
Yeah.
Just don't be sitting around, because that looks very bad and unprofessional.
It does. Whatever clinical you're on, if it's peds or med surg or OB, let's say OB for example, if you go to an OB clinical, expect to watch babies being born. Is that OB?
Yeah.
I can't remember.
Whether it's vaginal or C-section,
Yeah.
just be expected.
Right. Don't be like, oh, I wasn't prepared for that. Like, I don't think I can. No. Expect to do that. Expect to be a part of a code. Because I remember I was one time, like, we went to a clinical. I think it was critical care clinical, and the very first day, it wasn't our patient, but one of the patients on the unit coded, and our professor was like, go, 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 go. And let me tell you, when you walk around a hospital,
It looks quiet, looks slow.
yeah, it looks fine. And then when a code happens, everybody comes out of everywhere. Like, the whole place gets so packed, and you're like, where did all these people come from? But anyways, so it was our first day. It was like our first hour of that clinical. We're sitting at the nurse's station looking up our medication, and we hear cold blue, and everybody went running, and our professor was like, go, 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 go. And I don't think you were with me at this
I don't
clinical.
think so, no.
Yeah, it was me and some other girls. But anyways, so our professor's like, go, 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 go. And we go in there, and they're like, go do CPR, because all the other nurses and
Doctors
physicians
and techs and everything.
they were all on their way. But since we were right there, you have to start doing stuff right away. That patient ended up not making it through that code, and that was the first time I had ever seen a dead body in person. I was emotional. I was scared. My African culture, the way we deal with death and dying is a little different than how they do it here. It's kind of casual, I would say, here, but back home is very technical with that.
Same with like Indian culture.
Yeah, so it was really, so when my professor was like, you guys have to go do postpartum care, I was like, excuse me? Yeah, it was very emotional, but I had to do it because I was at clinical, and I didn't want to say no, because
And you can't say no.
Yeah.
Unless it's like really against like your religion or
Right.
whatever you believe in. But if you don't believe in it, like you can't say no.
Right.
Because then your professor's gonna think, oh,
Yeah.
this girl doesn't want to learn. She doesn't want to be here. Let me just send her home.
Yeah, and the worst thing you want to do is get on your professor's bad side.
Because they can feel you.
They can feel, they have your nursing life in their hands, so you want to suck up to them as much as possible. Not to the point where you're being disrespected or you feel disrespected, but you want to be nice and suck up to them, because at the end of the day, you just want to pass that class and keep it moving. You don't have to form a lifelong relationship with them if you don't want to. So yeah, expect to clean poop. Lots of poops. I was the
Let me
queen.
do a story time.
Yeah.
So
please
we
do.
were at our med surg clinic, and it was me, Mercy, and another girl. And our clinical instructor said patient in bed B or rooms whatever said had a poop explosion.
Yeah. We used to have a name for this, actually.
Code brown.
Code brown.
So
which
he said-
code brown is actually missing adults. But we called it code brown because poop is brown. And we always had a poop situation on our clinical. So we just came up with a name for it.
We were at clinical. This was a med surg clinical, and our clinical instructor said patient in room 5, let's say, had a poop explosion. She didn't say poop explosion, but
She
she
said
said
code brown or something.
So me, Mercy, and another girl went to the room, and we got there. We just looked at each other like,
Yeah,
who's
it
gonna
was
do
an
this?
explosion.
And then Mercy's like, I'll do it. So, bless her heart, she cleaned this whole thing up on me. This other girl.
I was elbow deep in it, like, and the funny thing, the other girl, Naya would help a little more.
I helped her, yeah.
But the other girl, she was really tiny. I'm 5'4". How tall
She's
are you?
probably like 4'11". She's really tiny.
She's small. We're both small women, but she's really, really small. She looks like a little girl, and she literally grabbed a little towel, like the wash towel, and she was wiping the patient's toe while I'm like knee deep in poop and trying to clean this patient, and she's over there like wiping the patient's toe. I'm like, what is that gonna do? But yeah, we had a lot of those experiences, a lot of poop explosions. So yeah, so we just came up with a name for it. So whenever we were at clinical, one of us would come out of a patient's room and say, hey, we have a code brown. Can anybody help? We were like, code brown, let's go help. And we would all go in there and basically clean poop. And I'm sure the nurses on the unit were confused, like, Code Brown, there's no missing person. We knew what we were talking about. So yeah, we clean a lot of poop.
And the thing is, with nursing, no matter how bad it smells, you can't show it on your face.
Right. You have to have, what is it called, poker face? You have to just, you have to pretend like everything is fine and dandy and everything smells like roses and peaches and cream, even if you're dying. Because imagine what if that was you,
exactly, and they were making faces.
Right. You know, kind of embarrassing.
Embarrassing would be hurtful too, because
it would be, So you just have to keep talking to the patient, make them feel comfortable, make them feel like they're important, because they are. Don't go in there pushing things and being mad and, oh my God, I can't believe I have to do this. In nursing, you have to do everything.
And also nursing, no job is beneath you. If you have to clean poop all day, you clean poop all day.
Yeah. I've had cases where I've had to empty out urinals, empty out like vomit bags, clean poop. I've cleaned a lot of poops in my day. Like,
Mercy's the queen.
Yeah, they used to call me the queen because I was so comfortable doing it. The thing with me is, the thing I don't like is vomit. I have a weak stomach for that. When I see somebody vomit, I want to vomit. But I can clean poop all day. I can suction, I can clean poop, I can deal with it. Blood, nothing. Like, doesn't faze me at all. But when I see somebody puke, that's it for me. I'm just done.
And another thing, you can never say in nursing, that is not my job.
Yeah.
You can never say that, because you have to do everything for the patient. Whether it's something from cleaning poop to suctioning them, to emptying their urine bag, anything, you have to do it.
Yeah. So just expect to do everything. Like, if you're the kind of girl that just likes to do your makeup, put your hair up really nicely, looking nice and just sitting there, nursing is not for you, because you will get dirty. As I've said before in a lot of my videos, sometimes you go to school or work with one color uniform, by the time you get home, it's a whole different color, because you have stains everywhere. You don't even remember how it got there. So that's just part of the job, and that just comes with being a nurse. So those are things you have to...
And especially like in a pediatric hospital, you're going to get peed on, you're going to get pooped on, you're going to get puked on, so you just expect it.
Oh, old people too, like, med-surg, you will get poop and peed and throw up and everything. You will... Some patients are rude, and they will throw stuff at you as well. Which, that's a story for another day, but expect to do anything and everything.
So the last point we want to talk about is how to act at clinical. One word I can sum up is professional.
Yes, that's a great one. I know it's easy to, joke around. It's really tempting to just be yourself and be childish, but you have to think about every clinical as basically like a job interview. Because especially if you want to work at that facility, or if you want recommendations from your nurses that works there or your professor, you always have to keep a professional demeanor, because that is like a job interview. You want to watch how you talk, you want to use your inside voice, make sure you're always dressed neat, don't
follow HIPAA guidelines.
Oh yeah.
Because everyone is watching you, even if you don't think they are. Doctors, nurses, patients, techs, they're always watching you to check. Is this girl professional? Is she nice?
Yeah.
If you're mean as a student, you're probably going to be mean as a real life nurse.
Yeah, and if you're not professional as a student, you're not going to be professional. Like, these are things you have to keep in mind. And also, if sometimes there's a lot of downtime at clinical, especially when you have those 12-hour clinicals, it's really tempting to just sit around. But I would say get as much experience as you need.
Oh yeah.
Because nobody's gonna hand it to you. You have to work for it. So you have to go around like asking the nurses, can I watch you do this skill? Hey, are you gonna go suction a patient? Can I go and suction the patient with you? Or can I watch you do it? Can I do a dressing change? Can I, whatever skill you can watch, because everything you will do as a nurse is basically available to you at clinical. I know this now, but I didn't know that then. Because when it comes to starting an IV, taking out an IV, and that sounds simple when you're a nurse, but when you're a nursing student, that's a big deal, and it's really scary. So the first time I did it, that was a big deal for me. So everything I learned in clinical, I always remember when I did it as a nurse. Go learn, learn, learn. Even if it's how to make an occupied bed, or how to disconnect an IV pump, or how to plug an IV pump, how to run medications through IV,
Do vitals for the PCA.
how to do vitals, how to just anything, how to put a gown on. And the worst thing you want to do is learn in front of your patient. You just don't want to look like you don't know what you're doing in front of your patients, because they'll lose trust in you.
Exactly.
They'll lose trust in
When
you.
you walk into a patient's room, act like you've done this for a million years. Act professional. Act like you know what you're doing, even if you don't.
Yeah, so that's basically, I think we touched everything. So that's basically all we have for this video. If there's something we didn't touch on, something you would like to know more about, leave it down in the comments and we will try to answer it. If you have specific questions for the both of us, let us know down in the comments down below. We hope to do a lot more videos, but it's just hard now because we both have babies.
Oh yeah.
And you guys, I don't know if you guys know this, but we live far away from each other. She lives about 30-40 minutes away from me, and we both have babies now, and it's just hard to travel and make a lot more videos, but we will try our best to you know, do some stuff. So if you guys have some peds questions, so she did hematology, oncology, peds nursing, so if you have specific questions about that, or if it's something you want to go into, leave it down below and maybe we'll get together again and do a video on that. And you guys know, any questions you have for me, just leave it down below and I'll answer it. So that is it for this video, guys. Thank you guys so much for watching, and we'll see you guys in the next one.
Bye.
Toast, or was it toast?
Cheers.
Cheers. Wait, when do they ever say toast?
I don't know.
Oh no, they say let's toast to this. Right?
I don't know.
What do they say before people do that?
I think it's let's toast this, and I think it's let's toast.
Yeah, let's toast. Okay, let's toast to this.